In current times, in the state of Florida, acupuncture physicians are licensed as primary healthcare providers. So they don't need referrals at this point in time in the state of Florida to see people. And it runs the gamut. Most practitioners are somewhat family healthcare providers, and they'll see everything on the spectrum, from all types of functional illnesses, like things like PMS, mood disorders, depressions. It's best known for its ability to treat pain, so of course you get a lot of pain syndromes, headaches, back pains, neck pains, all types of different pain syndromes. They also work a lot now more in terms of complementary to other types of conventional medicines or allopathic medicines. So in my own practice, for example, I do a lot of work complementary to people who are having treatment for cancer, for the side effects of traditional chemotherapies or radiation, and to work through the immune system to help boost the immune system in situations like that. But also in a lot of other kinds of critical health situations, they'll work complementary to the rest of the what's going on in allopathic medicine. Well, I was dragged into my first acupuncturist by the woman who's currently my wife. Has always been my wife, but at the time she was not. I was a fairly severe insomniac at the time, and I had been to sleep disorder clinics in New York City and had traveled the country, and there was a acupuncturist who was coming through town in Gainesville, where I was living at the time, Gainesville, Florida. And basically I got dragged in kicking and screaming, and the first words I ever said to this man who was traveling through town, who was an acupuncturist, was, I just want you to know I don't really believe in acupuncture. I think this stuff is nonsense. And he said, that's perfectly okay. It's going to work just the same. And within a couple of days, I was sleeping just fine. He gave me some dietary changes, some suggestions, some herbs, an acupuncture treatment, and the impact was so significant that within a few weeks I was quitting my job and moving to actually Black Mountain, North Carolina, where he lived at the time, to start to study with him. So I had my own personal experience with acupuncture that got me wildly involved with it. My daughter at the time had very severe asthma, which we also treated with acupuncture, Chinese herbs, and dietary changes based on the principles of Chinese medicine. And she made a very significant recovery. And ever since that time, I've been involved with it. Well, the way I approach healing, personally, and I think that historically the way practitioners of Chinese medicine and other traditional medicines have approached healing, is from a contextual basis. Each experience that a human being has is seen on a continuum of mind, body, and spirit. There's a lot of talk in modern times about the interaction between mind and body, or mind or body and spirit. And traditionally in Chinese medicine, there was no dialogue about the impact between mind and body because they were never divided in the first place. They see the mind and the body and the spirit as co-occurring aspects of a single phenomena. So as opposed to seeing there being a mental or emotional or psychological aspect to a physical phenomena, they see that each experience has both a simultaneously occurring spiritual, psychological, and physical aspect. And all of the medicine is imbued with that. So that when you address somebody from a Chinese medicine perspective, you take any symptom. Let's say somebody's having a mood disorder, a depression, and it's not divided from the experience that the body is having of that depression. It's not something that happens above the eyes, so to speak. It's not just brain chemistry. When someone's feeling depressed, for example, which would be considered a psychological or a mood disorder, they're feeling depressed somewhere and in a predictable pattern. So 8 different people can walk in and be diagnosed as being in, let's say, a major depressive episode from a Western psychological standpoint, and manifest 8 distinct patterns in Chinese medicine, not because the particular symptoms that they're having are vastly different. Lack of motivation, sleep disturbances, general depletion of the mood, but because the way they're experiencing those symptoms are different. So, for example, the somatic or physical aspect of that. And some of them might be that they get depressed in their neck and shoulders. And people who are depressed have a great awareness of that. You say, well, where are you feeling it? And they'll say, when I feel sad, I feel it, and my neck and shoulders tense up. Or others get a pattern where they can feel it along the sides of their legs and up and down their spine. Or others have difficulty literally lifting their heads as if there's a heavy weight on their head. So there's the physical manifestation of the psychological aspect. And it's not that one is causing the other, they're the co-occurring phenomena. That's on the most psychological end. On the physical end, every physical experience will be having a psychological and a spiritual aspect to it at the same time. Some people with lower back pains become very trepidatious, very fearful, very cautious. That's predominant emotional experience that they're having with that. And to a certain extent, because they're co-occurring phenomena, we're not necessarily looking for cause and effect, but the back pain is the fear, is the trepidation. Other people who come in predominantly for a lower back pain might be very agitated, very angry about it. And when they are made aware of this connection, and this is part of the beauty of Chinese medicine, that through the diagnosis there's an increase in the awareness that people have in their own experience of their bodies and the experience that they're having in the world, that they become aware, yes, when I am more angry, that is when I feel my lower back pain. I always just thought when my back hurts, I get angry. Others will become very ruminative, will tend to ruminate when their lower back pain acts up. They'll worry. It's never going to get better. It's not so fear-based, but it's very much a basis of rumination. And that's a different type of pattern in Chinese medicine. Others will actually have a profound lack of joy. You can see that the life literally comes out of them, and it co-occurs with this lower back pain. And others become quite sad about it, become morose, melancholy about their lower back pain. And again, is the lower back pain causing the melancholy, or is the melancholy causing lower back pain? It's not a dialogue we necessarily need to have. But what is important there is those are 5, just as examples, distinct patterns that a person can manifest with a lower back pain. And the treatment would be different based upon the psychological, emotional, spiritual experience that they're having when they have the lower back pain. So in the most psychologically oriented of illness with no seeming physical manifestation like depression, you have these co-occurring phenomena. And in the most acute physical situations like a lumbago or a lower back pain, you have this co-occurring psychological phenomena. And that's sort of how we address things from a Chinese medicine perspective. Now, acupuncturists can, in modern times, occasionally you have acupuncturists who want to take a more somatic approach, a more physical approach to it. And whether they're giving the nod to it or not, historically the acupuncture points they are using are also addressing those co-occurring psychological and spiritual phenomena. Acupuncture's history, the history of Chinese medicine, grew originally out of shamanic medicine and ancestral medicine. And so the way that it thinks grew out of a very spiritual context. Originally in ancient times in China, if somebody had, let's say, a toothache, for example, they would either evoke the spirits to cure their toothache, or if they were in ancestral medicine, they would evoke their ancestors who are still very much alive. They had great respect for their ancestors. What's important about the respect that the Chinese had for the ancestors is that there's a unbroken 2,000-year plus written history of Chinese medicine, and nothing was ever thrown away. Nothing. So, for example, if there's a particular epidemic that happens in modern times, we can go back and find a similar epidemic that happened 1,000 years ago and see this is the approach that was taken at that time, and we can use the wisdom of 1,000 years ago. There's the way information evolved in Chinese medicine and acupuncture was more mandala-like. Here's this piece of information. Here's this knowledge that's been found. Here's how we treat this. And just because something else came along, it wasn't that this was better and it was going to replace that. We have too much respect for what came before. It's that, okay, in what context is this the right approach, and in what context is this the right approach? The evolution of Western medical knowledge was very different. Western medical knowledge was much more linear in how it evolved. In the West, medical knowledge, you had a concept, an idea, a particular belief system. And then a new belief system came along. And there were only two things that could happen within the context of that belief system. The old one had to be eliminated. It was either totally eliminated and replaced by the new, or there was some synthesis between the two, and a third was created that replaced both A and B. And that's how Western medical information and knowledge evolved. So in the traditional cultures, in Chinese medicine, which I know most specifically, there was no need. See, they don't have an absolute concept of truth in terms of this is right and this is wrong. They have the concept of context, everything put into the context. So they ask the question, in what context would this approach be most applicable, and in which context would this approach be most applicable? Nothing ever got thrown away. And it's a beautiful, beautiful thing. And as a practitioner of Chinese medicine, it at times can be overwhelming because there's 2,000 years of written history, and we've probably translated into English. I don't do medical Chinese translations, but there's probably been, a page in the New York City Public Library that's been translated. In addition to the written history, there's this magnificent oral family tradition, and a lot of how I practice came through oral traditions as well. There's been great respect and not this clear-cut division between the professional practitioner on one hand and the lay practitioner on the other. There's a great respect for folk remedies in traditional Chinese medicine. Much of what's caught on in the West are these folk remedies, and they're quite magnificent. So always, you've seen this continuum. There was usually someone who was the healer in the home, whether it be the mother or the father who had a collection of remedies to address things. And when things became more critical or they weren't responding well to what was being done in the home, they would engage a local expert. And if the local expert couldn't help them, then they would bring someone from afar who would come and resolve the issues. And these issues often weren't resolved on a personal basis. You see, the person who would be brought in could say, listen, there's something collectively wrong with this little village going on here, and this needs to be corrected for this person to get well. So there was not these clear-cut divisions that we've seemed to have manifested in Western medicine today. Part of what the collaborative health movement is doing today is trying to, and the holistic health movement has been doing over the last couple of decades, is to replace this vertical relationship that's become in place, this professionalization of healing, and this vertical relationship where you have the healthcare provider or the doctor up here and then the patient down there, and then even within the healthcare system, you have this very, very vertical dynamic that goes on where you have your top dog, and then beneath them you have the next, and then you have lower than that. We're trying to replace that with a more horizontal relationship. Horizontal in that both the person receiving the health care is on the equal plane and is the equal participant in the process, and that all of those who are providing the health care, that there's not a hierarchical distinction between a medical doctor, an acupuncturist, a massage therapist, a folk healer, the yoga therapist, the massage therapist, whoever it might be, that these are all on an even field. We have this horizontal relationship that's been established. And within that horizontal relationship, we're going to go back to the mandala again. You have at the center of the mandala, this horizontal mandala, this horizontal dynamic, you have the person who is going to be taking care of themselves within this mandala, within this context. And they are going to solicit the aid of different peoples on different levels of that intervention. Remembering again that there's no real distinction between mind, body, and spirit, that at any level that you intervene, you're impacting all three, but one can intervene predominantly through the mind, through the body, or through the spirit. So, for example, if people are engaging any kind of talk therapy, any kind of psychotherapy, talk therapy, support groups, things of these sort, then you're impacting the mind, body, spirit, but you're impacting it predominantly through the mind, let's say. Or you can impact the mind, body, spirit through any type of physical movement or physical exercise as well. So a patient or a person who chooses to put together a support team, and this is really what they're doing. And patients are doing this accidentally all the time now. People in need are doing this all the time now. People who want to have better lives, who are not in any kind of acute need, are doing this all the time together now. So wherever they are on the continuum, from just being diagnosed with a life-threatening illness to having, optimum health in most ways, but looking to even optimize that further, or to grow spiritually, physically, emotionally, they look at it and say, okay, here's the question, now who do I need on my team? They're doing this a lot of the times unconsciously. In the old model, they're not assembling a team. They're going to their primary health doctor, who was, in some parts, playing a lot of this role. And to the extent that people had genuine family doctors who really cared about them and really knew their life stories, the old vertical paradigm wasn't falling apart completely. But about 20, 25 years ago, that paradigm started to fall apart completely, because there was no longer even the family doctor. The family doctor who I still can recall coming out to my home as a child and making the house visit, who knew who I was. If I had a crisis, they might be engaged in it, So to the extent that the family doctor may have been holding this paradigm together in bits and pieces, as that dissipated, it was replaced to it's pretty much every man or woman for themselves. You got out there and you have to navigate this terrain on your own, and people have been putting together teams. They have put together teams. Western medical doctors are still working on the illusion and on the assumption and of this old broken paradigm that what they are saying and what they are recommending is being done gospel by their patients. But that's not really what's happening. And David Eisenberg and company showed, I forget the exact year, but they did a widespread study that showed the vast majority of Americans, the widespread use of what they called complementary and alternative medicine, from everything from yoga and massage therapy and acupuncture and vitamin therapy, that the vast majority of people, it was this widespread unidentified movement that had happened. So people were already doing it. Now, psychologically, people are still caught in the old paradigm. Whenever there's a paradigm shift, whenever you have something as dramatic as something moving from a vertical relationship to a horizontal relationship, when something that dramatic goes on, there's such a cultural shift, you're still going to have vestiges of the old paradigm. And you're also going to have those who are most invested in the old paradigm hanging on for dear life. Now, it's been my experience. I started out in December of 1982. I had Western medical doctors who, at the Allopathic Physicians at that time, who would call me up and literally curse me out. Some of the very same people today refer their patients to me. That's how big a shift there's been. The same medical doctors that 20 years ago were hostile, openly hostile. And I used to tell them all the time, the more openly hostile they were to me. One time I had a medical doctor who literally didn't call me on the telephone. They came to my office, and I heard that I had my office all the way in the back at the time, and I could hear them shouting. And they said, where's Dan Neville? And he comes in the back of the office. And he went on and on about something that I had supposedly told one of his patients, which I hadn't, but that was besides the point. And I said to him at the end of it, I said, listen, I have great admiration for you. You're obviously a very dedicated and passionate and caring physician, because you came down here. Most of the times the doctors just call me up to yell at me on the telephone. But I really admire your passion. And I could see it in his eyes. I said, but you are ignorant about the subject matter that you're talking, and you really should know a little bit more about holistic medicine, which is what it was commonly referred to at the time. This gentleman today is a strong advocate of holistic medicine. I mean, he heard it. He had sort of one of those instantaneous aha moments that people have sometime. But for the most part, that's not what happens in paradigm shifts. So you now have this horizontal relationship. And at the center of this horizontal relationship, again, I'm going to go back to my mandala,
Sure.
is you have this person engaging it. And how they engage it differs from person to person. The needs that they're meeting or they're attempting to meet differs from person to person. But usually you will find, in reality, numbers of people on that healthcare team, or numbers of people on their team. It goes just beyond healthcare. But many, many people now have their primary healthcare physicians, or they have the other medical doctors they're seeing. They have a therapist of some point. They have a support group. They have their trainer, their yoga therapist, their massage therapist. They might have the group at the church that they attend every week that's operating to address some levels on a spiritual level. And they've put this together, either consciously with intent or unconsciously. This is what they've evolved. Now, a lot of things work against them doing a good job in doing that. To me, one of the great breakthroughs has been the internet, because it's been a very democratic kind of process where there's access readily available to people now. There's information that's readily available, and it's expanded the universe to you now have support groups online. So many of my clients now are members of support groups online for whatever condition they've been diagnosed with, or whatever spiritual pursuit they're taking, or whatever practice. If they're getting involved in yoga, you can now go online and find out about what's going on in yoga and the different kinds of yogas all over the world. It's a very, very different world. So this paradigm is now in place. And although there's a lot of resistance from the old paradigm to it, it is here. Individuals, because of the breakdown of the old paradigm, have been forced to participate in their own care, whether they like it or not. If you don't participate in your own care at this point in time in history, in the United States anyway, you're engaging in a very dangerous game, especially if you have any kind of health care situation of any critical nature. It is now dangerous not to engage in your own health care. As I said before, the old paradigm's broken down. People don't have primary health care physicians anymore who really know them in an intimate way. And it's every person for themselves out there. And it really is the wild, wild west. The trauma that's induced by not knowing what's right and what's wrong when people get diagnosed with serious illnesses is beyond belief. Well-moneyed, well-educated people getting diagnosed with serious conditions today are still traumatized by having to figure out and gather this information and come up with coherent strategies for themselves. Who to trust, where to trust becomes very, very problematic. And so much of the healthcare crisis that we're having in America today are with less than clear-cut diseases and illnesses. For most people diagnosed with cancer don't get a specific clear-cut strategy. There's not like this is what absolutely right and this is absolutely wrong. Most people diagnosed with any of the autoimmune diseases, with the lupuses or the rheumatoid arthritises, they're not getting this is definitely right and this is wrong. So what they end up doing is they end up becoming perplexed, and they end up putting together these ad hoc healthcare teams for themselves. And they're getting second opinions. Sometimes they're genuine second opinions, sometimes they're not. And they're going off to the hospitals, and they're consulting with their massage therapist. They're asking the salesperson at the health food store, what do they know that's good for it? They're out there yearning, they're out there seeking, but they're already creating this team for themselves. And usually people getting diagnosed with serious illnesses are also then looking into support groups, and they're gathering information from other people who have been through like-minded situations. And they might become more involved in their church or their temple or whatever spiritual pursuit they're having. I'm always pleasantly surprised at how many people take up recreations that they've enjoyed in the past as sort of a method of solace as they, or really just a meditation as they go through this process. So it's a shockingly difficult system to navigate out there right now. It's preposterously difficult. Well, some are luckier than others. And what generally ends up happening with most people is that they'll find somewhere along the way one practitioner that they trust. And then that practitioner will put them in contact with other practitioners. Or they might find another individual who's had the same illness with whom they connect with, and they end up with their same healthcare team almost to an extent. Or they'll end up at a yoga class and get some good information and some guidance. But it's a very, very difficult process, and there's a lot of luck involved. And a lot of trauma that people endure on the way to sometimes getting together a team that's appropriate for them. You could ask a lot of different acupuncturists that question, and you could get a lot of different answers. The answer that I can give you authentically for myself is that on a certain level, I have absolutely no idea how acupuncture works. But I know that it works. I observed it. One of the beauties of Chinese medicine and the philosophy on which it's based is that it assumes that the universe is unknowable. And it's a good place to start. But what it also does assume is that the universe is knowable. That it is observable. And that by observing it well, and by responding to these observations appropriately, and by intervening in one way or another, that you can get responses that you want. So there's not been a deep history, nor is there a deep concern on my part to discover the biomedical mechanisms that are working, but this is what can be said about it. That the ancient Chinese and throughout history have evolved this concept of this flow of vital influences. Qi is often translated as energy, which is not something I'm completely comfortable with, because energy is in my mind, a little too quantifiable. It's not measurable, but it's the vital influences. It's the activating force. And they've observed how this flows through the body, and also have observed the relationship through what we call systematic correspondence between one phenomenon to another. This relationships, or putting of all information or all things into the context of the whole to understand them, allowed them to see certain dynamics that would reign true in the body. So to give you an example, they noticed somewhere along the way that if you were to, I'm assuming before they were inserting needles into people, they were rubbing these spots, or that they were doing some other type of stimulation of the points, probably with stones, perhaps with energy emissions from, the Qigong lineage, but that they would stimulate a certain point along a pathway. Now, when I was first went into acupuncture, I held the belief and the truth that the acupuncture point and the pathways were basically a good way to remember points that went together. But early in my practice, I began to needle people, and I would do an acupuncture point, and the person would say, "Oh, that's an interesting sensation," and they would take their finger, this person with no history or experience in acupuncture, and they would, with their finger, go along the pathway of the acupuncture channel. And these are not necessarily nerve pathways. But I had someone one time, go from foot up the side of their leg, around the sides of their torso, up through their back and neck, and come through their head, and completely trace one of the gallbladder pathway, which is the longest pathway in the body and the most complex. And they did it with their finger, and they felt it. So then it became quite apparent to me at that point that these are really, to some people, very tangible, very real. And this particular person was not somebody who had been working for many years on their any kind of esotech. They happened to be a truck driver, which was interesting to me, that the person who was most sensitive to the acupuncture pathway was, it blew a stereotype for me. What's most important about acupuncture, and there's a lot of Western research that's going on to it today, is that you can quantify the results. Okay, you can see that if you follow a particular system, and there are many styles of acupuncture. If you think of all the styles you have in body work, or all the styles you have in different kinds of psychotherapies, and you think that acupuncture's had a couple of thousand extra years to evolve different styles, there's many, many styles. But if you're consistent within the styles, within the diagnostic principles of the style and in the therapeutic principles of the style, that you can get consistent and measurable results in terms of how people are experiencing themselves on, again, the mind-body-spirit continuum. You can get consistent results in reduction of pain, or whatever types of laboratory studies you're following, or what kind of experience the person is having will be expressed differently. The relationship that I have with the conventional medical doctors is dependent upon the relationship that the person that I'm working with, who's also working with that conventional doctor, wants me to have with that doctor. So I believe very strongly that we'll call them the patient in this particular case, or the client, that they should be the determining factor as to the dynamics that are created between all of their practitioners. I have clients who want me to not engage at all in any dialogue with their practitioners, which is perfectly okay. That's their choice, and that's what works best for them. And then there are others that want me to dialogue extensively with them, and I do. I approach every conventional practitioner with an open mind. I'll share with them the information the best that I can. I understand that at this point in time, I can't make them open-minded. And oftentimes my clients will say to me, well, they'll ask me the question, they'll say, what do you think my doctor will think of this? And I said, well, not knowing your doctor, I don't really know. But I can tell you, depending on the particular thing that we're talking about, and let's work on that it's something, let's say, that there's been a published study on. I said, if your doctor's educated on it, then they'll be very open-minded to it. If they're not, they'll be open-minded to it if they're an open-minded person, and closed-minded if they're not. We're still in a point in terms of conventional medicine right now where we're running the gamut in terms of how open-minded and receptive and also knowledgeable conventional practitioners, conventional Western medical doctors are in terms of all the alternatives, and specifically acupuncture. Acupuncture has gotten a lot of favorable press in recent years, and also a lot of favorable medical press, so that generally speaking, conventional medicine is not antagonistic towards acupuncture if they feel, again, from their vertical perspective, that it's maintaining its proper place, and that patients aren't ignoring the Western medical aspects of it. But again, I say the overall dynamic has improved dramatically. And I also always try to approach it from an educational standpoint, if there's education to be able to be made. Now, that said, I have to use the opportunity to speak to the non-conventional community as well, the holistic or alternative community. They also run the continuum in terms of their antagonism and their receptivity to conventional Western medicine. And so I have found the same kind of closed-mindedness on occasion in the alternative community. In other words, don't have anything to do with Western medical profession, don't have outright hostility, and that runs the gamut to people who are open-minded and want to work. And I don't think that either the conventional medicine has exclusive rights on being closed-minded in this regard. And it's an equally big problem, because for those who are looking to work collaboratively, to those who believe that have great respect for the client and their native intelligence, and believe in educating them to make the best decisions that they can make, I think that we can't have that antagonism and that closed-mindedness coming from any of the sides on any of the continuum. And it's a problem. It is a problem on both sides. The reality is, again, we go back to it, the whole thing is a mystery. And sometimes within that mystery, you have there's this continuum in this mystery. Sometimes the mystery is not immediately life-threatening. So you're talking about somebody who wants to enhance their abilities to perceive, or wants to grow spiritually or psychologically. Well, you don't have the same sense of critical mass there that you do when somebody's diagnosed with a life-threatening or a serious situation, or that they've had their comfortable life situation intruded upon by any kind of illness. It doesn't have to be life-threatening. But that's where it becomes more critical, to try to surround yourself with people who are open-minded, who don't think that they have the totality of all the answers, who know that you're trying to come up with strategies that will work best for that particular person. And if any person who wants to superimpose their particular paradigm or their particular way of being in the universe onto another person, to me, is, it's somebody that a person should be cautious of. Whether that paradigm they're trying to superimpose or that belief system trying to superimpose is one that's closer to something that I believe in, or something that's really very much an enigma to me, I'm antagonistic, it doesn't sit well with me, it's still, a person has to start with a respect. And it has to start with an open-mindedness. And it has to happen in Chinese medicine, we have a principle called the empty vessel. And the principle of the empty vessel is something that I try to abide by at all times. If you really want to understand what another person is experiencing, expressing, or trying to communicate to you, then you have to be an empty vessel. And the example that they use is if you have a vessel that's filled with blue ink, and you empty it half out. In other words, you get half of your preconceived notions out of you, and then you put in red ink, you have purple. But if you get all the blue ink out, you only need one drop of red ink, and you have pure red, and you have some sense of what the person is trying to communicate. So I think that we have to have a sense of being able to empty ourselves in the best interest of the people that we're working with as healthcare providers, and to address every conversation with no preconceived notions. And to that extent, every conversation I ever begin with a Western practitioner of medicine begins with the fact that, with the belief system, until proven otherwise, that they're going to have the same kind of attitude that I do towards respect for their clients and open-mindedness in the dialogue. When I begin to work with a new person, a new client that I'm working with, I begin from that spot. And as I previously mentioned, we have this concept of the empty vessel. I try to empty myself of myself. And there are actual practices that a acupuncturist can do if they're practicing from a more traditional standpoint to do this. And it's an interesting thing. It's not about a matter of timing, but it's about having an empty mind and in terms of emptying yourself of yourself when you start to interact with the person. And you do it so with a sense of mystery. Because we work in a modern Western context, you have an intake form, and there's you could jump to certain conclusions just from the intake form, but instead of trying to jump to conclusions, what we first try to do is you have this sense of mystery. It's all coming to you, and the best way I can make the example, and the way I'd make it to acupuncture students is, there's the days you're really watching the sunrise. And then there's the days you're hanging out and talking and chatting, and you're sort of watching the sunrise. And when you're really watching the sunrise is when you've emptied yourself of yourself. And to a certain extent, you're merging with that sunrise, and you get that sensation, that feeling, that zone. You're observing the sunrise, and you're really with it. And some people refer to this as a peak experience. I just refer to it as being empty of yourself and sort of merging. And it's this sense of mystery. You're not trying to, at that moment in time, say, now what is the biomechanics of the sunrise? What's really going on? The sun's not really rising, the earth's rotating. That's not where people are at. They're in this sense of awe, this sense of mystery. And as practitioners, if we can get into this sense of mystery, each person that walks into our presence is this magnificent life story. And what we're really trying to grab is as much of that life story as we can. There's a belief system within Chinese medicine that the part contains the whole. There's two aspects to holistic medicine. One is that what we call contextual thinking, that all phenomena need to be put into the context of the whole to be understood. That's one aspect. But the other aspect is that any individual phenomena contains the whole, so that on a physical level, you can take the radial pulse and feel the whole body in that. You can look at the tongue, or there's a system of microacupuncture where the whole body is reflected in the hand. But on the other hand, the masters are said from a single pulse taking to be able to feel the whole life story. That a single breath, if you can really empty yourself of yourself and observe one single breath that a person takes, one inhalation and one exhalation, you can know their entire life story if you're empty enough. Because through that one inhalation and one exhalation is the one interplay of yin and yang. And on the largest level, you have your first inhalation when you're born and your final exhalation when you pass on. And so you inhale and you exhale, and then you do that a whole lot of times in between. And that one individual inhalation and exhalation contains the whole. It's not just information gathering. In Chinese medicine, they have what we call the 4 methods. And through the 4 methods is how we draw this whole context from which we're going to operate. So we're listening and smelling. This is and we're palpating, and we're looking, and then we're asking. And so that if you ask somebody a question, the affect with which they express the answer holds equal weight to the content of the answer. So you could say, what kind of pain are you having there? And 5 different people might say, I'm having severe pain. But one might say, I'm having severe pain. And another, I'm having severe pain. And the nature of that expression will tell you as much about what's going on with that person, and as I said, holds equal importance. So as you navigate the person, if you have this continual sense of mystery, at no point do you know. At no point do you have, at some point you have to have sort of an idea of what direction you're going in. But you still have to keep the mystery there so that at the end you can take all that you've gathered through your mysterious exploration and create a context. And from that you have what we would call a working diagnosis or a set of assumptions, a place to start with this person. Now what's Chinese medicine, one of its beauties is that there's no such thing as a definitive diagnosis because it's a statement about a person in a particular moment in time. So at this time, this is what's true. And then as you practice them, as you do the acupuncture treatment, or as they take the herbs, or as they make the dietary or lifestyle changes, what was once true is no longer true. The pattern might be there, the meta pattern might be there, but you must respond immediately to the new pattern or the new set of circumstances as they present themselves to you. So it's a very live, it's a very vital, it's much more of a dance, let's say, than making a definitive diagnosis and this is what you take and this is what you do. It is an ongoing dialogue, and it is an ongoing dialogue of a person with themselves, and then secondarily, the person with the practitioners. The viewpoint that there's a definitive diagnosis or definitive statement to make, although it's a widely held belief, and we have to make things up sometimes and believe in them. You know, we need the first the Tao Te Ching says that the Tao that can be spoken of is not the Tao. So even in Western medicine, we're using a more metaphoric way of saying things, which works better really for the human condition than does ordinary linear language with their definitive statements. Because to a certain extent, it has to be less true. The same way that in certain levels, a photograph may be less true than a moving film, right, a continual film. But on the other hand, a photograph can tell quite the story. So you have to have respect for the photograph, too. You have to have respect for the definitive statement. I like some of the definitive statements I'm quite fond of Western medicine when it's appropriately used from the perspective that I see it. It can see things. Western medicine predominantly is reductionist in its nature. Traditional medicines are usually, and Chinese medicine in particular, are holistic in their concepts. We take phenomena and put them in the context of the whole to understand them. In Western medicine, they reduce phenomena to their individual parts to understand them. That's good information to have. They've discovered, through technology, have come up with many, many ways to see those little individual parts. So we can see the dance inside the blood in a better way because of Western medicine than traditional medicine could ever see. But we can see the dance of the blood through the body, on the mind, body, and spirit, far better in traditional medicine and Chinese medicine than they can in Western medicine because blood is not blood outside the body in Chinese medicine. And blood doesn't really become useful to Western medicine, for the most part, until it's outside the body, measuring the individual parts. So it's not that they have to be exclusive, both have visions that have limits. Both have ways of navigating the universe that have their limitations. And when they're used together to the best advantage of the people who are engaging them at any time, and you can't make a definitive statement about how much a person needs to use Western medicine, how much they need to use alternatives or other traditional medicines, because at different times in their lives, different people are going to be using all of those resources to a greater extent. That said, my belief system generally holds that most of conventional medicine is sort of an emergency intervention. It's now, for the first time, starting to pay some attention to preventative medicine. But for the most part, they're fixing something after it's broken. And one of the most overwhelming experiences I had was the first time I realized how many people go to conventional Western medical doctors and are told, there's nothing wrong with you, come back when it's worse. In other words, if it's not measurable, they can't measure it, then it doesn't exist within that paradigm. It's very valuable to have a more holistic context for these things to operate in. Sometimes you're just talking about medical error. If somebody goes to a doctor and everything's okay, maybe perhaps the doctor wasn't thorough enough. And I don't know that you can completely eliminate that phenomena even by doing everything perfect. Sometimes we get back to the mystery. Sometimes things just happen. But it's a lot less likely to happen if you're looking at things and problem solving from multiple paradigms. It's been very popular today, something that we're calling integrative medicine. And integrative medicine is predominantly comes from a Western medical paradigm, because integrative presumes you must be integrating it into something. And what they're integrating it in is to the Western medical paradigm, and they're picking and choosing from the different techniques. Acupuncture is not just a technique. Yoga is not just a technique. They are also ways, paradigms, and ways of viewing the universe. It's ways of organizing information and give you alternate ways to vision any particular issue or problem. It's a different way of problem solving. Where Western medicine is reductionist in their problem solving, Chinese medicine and acupuncture are contextual and holistic. Where Western medicine embraces objectivity, Chinese medicine embraces subjectivity. Subjectivity is used scornfully by Western medicine. And far from scorning subjectivity, Chinese medicine, many people are trying to say it's objective, but Chinese medicine is taking subjectivity to high art, to the extent that we're subjectively taking somebody's pulse. Okay, now we're emptying ourselves of ourselves and we're listening for information, but it's still a subjective experience. We want to take subjectivity to the highest art possible. And so, far from being a bad word, it's just a different way to gather information. There can't be for it to be best for the person, there can't be antagonism on the part of those who are seeing from a reductionist scientific way towards those who are seeing holistically and contextually, nor should there be antagonism from those who are seeing holistically and contextually towards those who are seeing from a reductionist scientific model. Where a person gets the most benefit is from multiple genuine views. Real second opinions would be opinions that come from different paradigms, who are problem solving differently. So when a person goes to a practitioner of Chinese medicine, they're getting holistic problem solving. This is a good thing. When a person goes to a practitioner of conventional Western medicine, they're getting scientific reductionist problem solving. This is a good thing. Then a dialogue can happen, hopefully, between the person who's actually being dialogued about and those practitioners can be having a respectful dialogue with each other, all in the best interest of the person. This is how it has to work out. There has to be this type of collaboration. There has to be this type of respect for this for the multiple types of problem solving. You can practice acupuncture, the technique, from a Western medical model, and it will work. You can integrate it into the Western medical model and practice it scientifically, but you can't practice acupuncture and Chinese medicine scientifically. You have to. Doesn't mean it's not scientific. It can't be scientifically validated, but it must be practiced from a holistic context. And so people must be working together respectfully and collaboratively. I think that what's happening is that it's an attempt to begin the process of bringing a collaborative medicine into the 21st century, utilizing all of the tools that a person is already utilizing. A patient is already using most patients with serious illnesses are already using multiple practitioners. Most patients are already using support groups. Most patients are already using the internet. The problem with all of this is that you can't really, first of all, it's a very hard task to get the best information, even if you're good at the process. And let's assume you're good at the process. At best, it's difficult to get to the best of the people and to get the best information that's available on the internet. At worst, you have to go through a lot of inferior practitioners and get a lot of misinformation off the internet as well. So that any attempt, from my standpoint, to put sort of a quality check and to make that process easier, it's not something that's being invented that's new. To me, I see that it's something that's already happening. People are already doing this, and it looks like it's something that's coming together to make that process easier, more effective, and probably safer as well, and with a lot less trauma along the way. But it's what people are doing already. The clients who are engaging alternative healthcare practices are already doing all of the things that are being offered, but they're doing it with great difficulty. What I'm most excited about is that I'm also always engaged in the process of trying to find open-minded Western medical practitioners and like-minded and open-minded alternative practitioners, and also ones who are good and experienced at what they do. So for me, I'm most excited about this. A lot of that work being done for me. I know the people that I've worked with within Miami over the years. I love the thought of both a local network growing out of this and the potential for a long-term national network is very exciting to me, because people move, and we're in a mobile culture. And so that's what's very exciting for me in terms of being able to have that kind of dialogue, and that work made easier for me as well. My overall philosophy would start from this. I very much believe in the autonomy, the intelligence of my clients. I know this. Each one of my clients, when they walk in the door, are the world's leading experts on themselves. And all healthcare practitioners are coming from the outside, trying to get a little bit of expertise on who they are. But there still is no one who is more intimately knowledgeable and more of an expert than the patient themselves. And so I begin with that assumption. And I work from a place of again, trying to be empty, trying to be receptive, trying to figure out who and what their needs are, and then trying to meet them the best way that I can from within the skill set that I have to offer them. And I also try to guide them whenever possible into directions that are useful for them as well. No one knows more about you than you do. What you say is true, what you say and what you're experiencing is real. Put together a team for yourself that knows that, and then you'll be okay. When we start to talk about alternative practices that are there, and I'm not sure what they're alternative practices too, but when we talk about all the different practices and all the different methods of healing that exist, One of the things that has happened within traditional medicine, and also has happened a lot within holistic medicine, even with some of the newer techniques that have evolved, is because it comes from a place of respect for what comes before. And because the natural human impulse is to refine and to improve and to shift systems to a particular needs, the average person is left with a tremendous myriad, a limitless number of techniques and styles, both from within acupuncture, where, for example, the best-known styles in this country would be what we call TCM, which is what's taught in most of the acupuncture schools at this point, which is medicine as it's practiced in mainland China today. You have some of the extraordinary vessel lineages. You have the 5 element schools. So you have many different schools and styles that have evolved. And again, all the family styles that have evolved as well. But then within, for example, massage therapy and body work, there's so many styles. Some that consciously integrate the mind-body paradigm, some where the techniques are gentle and rocking, some where the techniques are deep and more precise, others where you use more the pathways or regions of the bodies, others where you use particular points. You have all the different types of talk therapies that have evolved, and offshoots of offshoots and offshoots. And all of these are beautiful things. What's most important is, again, trying to choose from these practitioners people who are looking to not have definitive answers to any individual situation. What I have found to be true over the years, this I didn't see, the truth of this has come to me from my patients over the last 20 years. No individual technique is ever really critical. I mean, I'm an acupuncturist. I believe greatly in acupuncture and what it can do. But what's most critical is to put together a team of people who are respectful, who understand that they're working for you, that genuinely want to work from your behalf, who are good and experienced and expert at what they do, but also have a bigger vision of the whole picture. The other thing I say is that one of the things that what always made a good practitioner traditionally in Chinese medicine is that they also did practices that cultivated themselves. It was expected that the healthcare provider or the healer was also engaging in practices that cultivated their qi. Now, traditionally, this might have been qigong or tai chi, but often many of them were gardeners and cooks and things of that sort. And to that extent, you want people who are engaging these things themselves to an extent in an attempt to make themselves as healthy and as whole and as integrated as they possibly can be. This is distinct from just looking for people who are perfectly healthy, because some of the great practitioners I have met over the years are people who have had very serious health challenges and have overcome them either completely or partially. And again, some of the practitioners I've known who are extraordinary have engaged these situations. But they all have in common, the practitioners that I've had the most respect for over the years have not only put a lot of energy into the specifics of their craft and to their techniques, but have also spent a lot of time cultivating themselves as individuals. And that in and of itself cultivates a respect for other practitioners. So I think that the advice I generally give to people is don't settle. That as you navigate, if you're sick, don't settle. If you're thinking of asking the question, ask the question. If you're thinking of making the demand, make the demand. And you should have the highest expectations for yourself and for all the practitioners and how they work together with each other as well.